Like you said, it's detective work, and it's trying to understand how does the body work versus trying to label what that patient has. And it's a huge distinction between what and why. So, usually, and I kind of laugh with my patients, especially when we talk about things like migraine. So a patient goes into their doctor and they say, Doc, I have this horrible pain behind my eye. It's throbbing on the side of my head. And, it happens and I get, light sensitivity, sound sensitivity. I have to lay in bed, have these horrible migraines. And the doctor says, well, let me take a look at you. And the doctor takes a look at them and does a physical exam and says, well, Mrs. Jones, you do have migraines. And it's like, Doc, I told you I had migraines. I didn't need you to tell me that. I want to know, why do I have migraines? And the doctor
happens all too often.
But the doctor's like, listen, we don't really worry about why you have them. We're going to rule out a tumor, so we'll do an MRI. But basically, what we can offer you is a series of different medications to try to manage the migraines. So, managing a problem versus fixing it is very different. So what we do in our field, in neurology and functional medicine, is to try to find out, why does this person have this? So with migraine in particular, we know that it's a dysfunction for the most part. Pure migraine is a dysfunction in something called the trigeminal vascular system. So the trigeminal system is in the brainstem. It's a series of nerves in the cranial nerve area that controls the vascular system. And when you have dysfunction in that region, it causes changes in the way your body handles electrical activity. So it's a change in electrical activity in the brain. It's almost like a brain attack. So, we have to look at that when, previously it's always been thought that this was a vascular problem. And, although there is a vascular component, it's a primary neurological problem. And it can be caused by many different things. So we have to kind of step back and go, well, what does the research say? The research says that the common ground with all these people is that they have brainstem dysfunction. And that doesn't show up on an MRI or an EEG. So we have to be really creative and come up with ways to identify that. So we could do it through clinical exam and the type of evaluations that you and I do. But then we can look a little deeper. We could do, specific testing to actually videotape eye movements and look at, the major, processes that the eyes can go through, like, saccades and pursuits and vergence, and, and all the different, minor tweaks that can happen within those specific movements. But then we also have to look at what's going on chemically, because very often a patient will say, well, when I drink coffee, it increases my headaches, or if I have chocolate, or certain foods, or if I get really cold, so a lot of different kinds of chemical things go on. So we have to do, we do extensive lab work, blood, urine, stool. And then they also commonly complain about neck pain that goes along with the headache. So we have to look at the structure and look at how their TMJ is working, how their neck is working. So we really need to be the ultimate generalist when it comes to evaluating our patients, because we don't want to fit them into a box. We want to create a box for them.